Picture, if you will, lying on a medical table in the center of an 1835 operating theater, under the cold gaze of numerous spectators. In a time before anesthesia, when only half of all surgery patients survived. And if that wasn't frightening enough, imagine hearing your surgeon utter 3 words that make your blood run cold. Time me, gentlemen. I'm DreyOfTheDead, and it's time to feed your head. Born to a Scottish minister in 1794, Robert Liston dedicated his life to becoming a surgeon. He entered the University of Edinburgh at age 14, training under famed anatomist John Barclay. By 20, he was appointed to house surgeon and admitted 2 years later into the Royal College of Surgeons in London. In spite of his young age, Liston had a reputation for being abrasive and argumentative. Standing 6'2", he was also rather imposing. After a disagreement with Barclay, he opened his own anatomy class in 1818, which attracted 60 students. As a teacher, he was tough and demanding. His trainees served as his dressers during surgery, and he often berated them when they didn't meet his standards. He seemed to compensate for this outside of surgery with kindness and generosity, occasionally inviting his class to his home for dinner. Liston was also immensely critical of his peers. He openly condemned surgeons he didn't respect and those whose methods he considered inferior. His unpopularity was fueled by his surprisingly charitable nature toward the poor, the sick, and the quote-unquote incurable, turned away from the infirmary. Fearlessly, he operated on patients whose conditions were considered too severe by other doctors. This earned him a brief banishment after he was accused of stealing patients from the facility. As a result, he packed up and took his skills to the University College Hospital in London, where he worked as professor of surgery for the rest of his life. Liston's bold ethics made him the target of further criticism. Unlike most doctors, he considered the emotional state of patients before medical procedures. He firmly believed that surgery was a patient's last resort, and that a surgeon must also know when not to operate. He encouraged trainees to comfort patients and calm their fears. If the patient continued to express dread, the operation was postponed or canceled. He was also one of the few to consider surgery the first step in the treatment process, noting that aftercare was even more important than the operation itself. Long before the introduction of hand washing in 1847 and Joseph Lister's germ theory on disease, Liston was a pioneer of improved hygiene to prevent infection. This outraged surgeons everywhere, in a time when unwashed, blood-stiffened coats were worn with pride during surgery. Liston took it upon himself to don clean aprons, use clean sponges, and wash his hands before procedures. His dressings were soaked in cold water, rather than the usual salves that often harbored bacteria. These uncommon practices were considered prudish by medical professionals. But perhaps his most famous confrontation was with anatomist Robert Knox. In a time where Edinburgh medical students needed bodies to dissect, grave robbers turned serial murderers William Burke and William Hare supplied corpses to Knox for a fee. Suspecting that Knox's cadavers were victims of the infamous duo, Liston burst into Knox's lab. There he found the corpse of a young woman, Mary Patterson, in an indecent pose. Outraged, the large Liston threw Knox to the ground and carried the body out for a proper burial. Despite his detractors, Liston rose to fame. Realizing that minimized surgery time improved survival odds, he was able to achieve amputations in 2.5 minutes, and was heralded the fastest knife in the West End. Liston rejected the common idea that the excruciating pain of surgery enhanced the healing process. And on December 21, 1846, he became the first surgeon in Europe to use anesthesia. His patient was a man with years of knee problems and unsuccessful treatments. Liston administered ether vapors to the man through a rubber tube, exclaiming, "The Yankee Dodge beats mesmerism hollow." Mesmerism, or hypnotism, was big at the time to control pain during surgery. Upon the first sign of unconsciousness, he removed the man's limb in 30 seconds. Moments later, the patient awoke and asked, "When are you going to begin?" This was met with such laughter from those watching that the patient shouted, "Take me back, I can't have it done." It was not until he was shown his amputated leg that he realized the operation was complete. This operation not only made history, but created it through two of Liston's students who were present for the procedure. One was James Simpson. Just 16 at the time, James left the operation wondering if ether could also relieve the pain of childbirth. He worried about the impact of ether on an unborn child, and experimented with a multitude of chemical cocktails that might be considered safe. One day, a Liverpool chemist recommended a new compound to him, and James decided to try it out on himself. The experiment was effective, as James found himself waking up off the floor. The compound was chloroform, and its use in medicine and childbirth elevated Simpson into medical history. The second student was none other than Joseph Lister, who was not an exceptional surgeon, but went on to revolutionize the medical field with the introduction of antiseptics. Lister's work led to a dramatic reduction in post-operative infections and distinguished him as the father of modern surgery. Liston revolutionized the art of amputation through a standard method. First, he would wrap his arm behind the extremity and make a circular incision. Once the limb was removed, he found that cutting away the piece entirely left little to sew back together. So he devised leaving a U-shaped flap of skin that could be pulled over the wound and secured with sutures. For this, Liston created a long straight knife with both edges sharpened, which he often held in his teeth while his hands were busy. He also invented forceps with a built-in snap meant to control arterial bleeding. These, among other inventions, became the standard amputation tools we use today. Between 1835 and 1840, Liston had performed 66 amputations with only 10 deaths, an impressive rate for a time when postoperative infections and gangrene were common. Despite his success, his recklessness during surgery resulted in a few fatal mistakes. In one case, he argued with his house surgeon about whether the tumor in a young boy's neck was a skin abscess or an aneurysm of the carotid artery. Believing the patient was too young for an aneurysm, he lanced it on the spot and was met with arterial blood, causing the patient to expire before him. In another case, he successfully amputated a man's leg in 2.5 minutes, along with his testicles. And in arguably his most famous case, he amputated the leg of a man in 2.5 minutes, accidentally severing the fingers of an assistant and slashing through the coat of a spectator in the process. Both the assistant and the patient died as a result of gangrene, and the spectator passed from shock, resulting in the only operation in history with a 300% mortality rate. If you enjoyed this strange but true tale, be sure to subscribe and check out previous episodes. We try to put out new videos every other Friday. If you enjoy blooper reels and behind-the-scenes footage, you might want to consider joining my Patreon. These are just a few of the patrons who make these videos possible. As always, guys, I thank you so much for being here with me, and I really hope the year has been treating you well thus far, or I'm gonna kick its ass. Be well and stay strange.